Hi there, my name's Dr. Sinha and I'm a GP and longevity doctor. Today, I thought it would be good fun to walk through a calculator that's online provided by the NHS in the UK, which gives you a good idea of what your heart age is like. So this is a proxy marker. It's a proxy function for health and more specifically the health of your cardiovascular system. So with this tool, feel free to have a look. It works by asking a few routine questions, takes maybe 3 or 4 minutes to walk through, gives you a good idea of what your cardiovascular system health and status is like. It works for people over the age of 30, and it's not to be used if you already have an established condition that affects your heart or your blood vessels. Before you start, it's good to have a few parameters available: height, weight. Most people have these at hand anyway. If you do know your blood pressure and cholesterol, it adds more credence and more value to this tool, but you can still plod on through even if you don't have that information. If you have it to hand, do go and get it and work your way through as I go through it too. What I'll do is I'll click through now, and then we'll get to the end and we can see if we can make sense of what parameters actually add up to give us an idea of our heart health and why they're important, and also what things you can do to modify your heart age and modify your risk with the biggest bang for buck. So how old am I? Let me go and click this through. 42. Do I have any cardiovascular disease? No, I don't. When we talk about cardiovascular disease, we're really talking about 3 main things in the context of this tool. One is coronary heart disease. This is things that cause things like angina and heart attacks, stroke, as well as peripheral arterial disease. This is known as vascular disease also, and usually affects the vessels of our limbs, such as our legs and our arms. A lot of these conditions are hereditary. So there's one of the questions that asked if this is a condition that flows through in your family history. But for me, I do not have any established cardiovascular disease. I'm male. My ethnic group isn't actually on here, but I'll put Indian just for the sake of ease. Let me put a postcode. So postcode's quite interesting because where you live is quite interesting. So there's data in the UK where we know there's massive differences in life expectancy related to the area where you live, related to green areas, related to the value of property, and related to the quality of living. So all these things impact our lifestyle, which also impacts our health, especially our cardiovascular health. So where we live is relevant and it's a marker worth adding in. Do you smoke? I'm going to put no, I quit. And if you do smoke, obviously that is a big risk factor for cardiovascular health. I'm 6 foot tall. My weight is about 90 kg. Do I have type 2 diabetes? No, I don't. Why is diabetes relevant for heart health? Diabetes is really a condition that increases the risk of multiple other conditions. Having excess sugar in the blood damages blood vessels. Damaging blood vessels is one of the kind of fundamental first steps in causing the type of changes to blood vessels that increase the risk of things like heart attack and stroke. It can also literally damage smaller vessels in the eye and in the peripheries of our body by virtue of just having too much sugar there and secondary changes that occur because there's too much sugar in the blood that isn't controlled. Have you been diagnosed with rheumatoid arthritis? No, I do not have this. Most people think of rheumatoid arthritis as being a condition of the joints, and primarily it is, but it is also a systemic condition. It's a condition that affects multiple parts of the body, and it's also an inflammatory condition. It's a condition that causes inflammation, especially of blood vessels. So damage to blood vessels is, again, one of those first fundamental steps in the process of causing things like stroke, heart problems, peripheral arterial disease. So anything that causes systemic inflammation is generally going to be something that increases your risk of cardiovascular disease as well. Chronic kidney disease, I don't have this. The kidney is such an important organ when it comes to heart health. The kidney's primary responsibility is to manage toxins in the blood, and it relies on a constant flow of blood to the kidney. If there's kidney damage or kidney disease, that affects the types of hormones that are released by the kidney, which subsequently affects the pressure of the blood being supplied by the kidney, which subsequently increases the work of the heart and the blood vessels. So kidney disease, kidney damage tends to affect the blood pressure, tends to affect the flow of blood, which affects how the heart, especially the heart, pumps blood, especially if it's against a higher pressure. Atrial fibrillation, I don't have that. That's an irregular heartbeat. It's known as being irregular. So normally our heart pumps every second or so in a very smooth, very predictable fashion. If we have atrial fibrillation, the heart pumps irregularly. We don't know when it's going to pump, and it pumps sometimes fast, sometimes slow. It tends to be a quite sporadic rhythm. What this means, if you can imagine, it's that beat is being generated from your heart. It essentially causes a kind of whisking type effect in the chambers of your heart, which causes the blood just to become that little bit thicker, that little bit more likely to clot. And when that happens, small clots can be literally pushed through the cardiovascular system and they can lodge in different parts of the body, commonly the brain, causing a stroke. There's about 5 times increased risk of having a stroke if you're known to have atrial fibrillation. So one of the main treatments for atrial fibrillation, as well as regulating the heart rate, is having a blood thinner to keep the blood thin and prevent it from this hypercoagulable or very easy to clot state. The next thing is about family history. Does your mother, father, sister, or brother have cardiovascular disease? That is true. Yeah, my mother has cardiovascular disease before the age of 60. Family history is a major predictor of risk for you as an individual having cardiovascular disease. Probably about 40% of cardiovascular disease has a hereditary component. It doesn't mean that if you do have it in the family that you will have it, and vice versa. It doesn't mean if it's not in the family that you won't get it, but it's definitely something that one of the main things that we ask about when we're interested in history is about cardiovascular history and cardiovascular health. It becomes more important the earlier that someone suffers with something like a stroke, peripheral vascular disease, or a heart attack. It's not unusual for people to have heart attacks at 30, 40 years of age. If that's the case, there may be a strong genetic component. There are blood tests and additional testing that can be done if you have that in your family. If you have people 50, 60-year-old with cardiovascular disease, that's more common, especially in the context of if they are people that are generally unhealthy and smoke, drink excess alcohol, etc. It may be more explicable from their lifestyle and less likely due to genetic concerns. But nonetheless, anything below the age of 60 as a kind of cutoff, it doesn't have to be that hard and fast. You should be more interested in understanding your family history. If there is a strong strain of cardiovascular disease in your family, you need to understand that, and you probably should be working quite hard to undo that. Do the right things, modify the right risks, and decrease your total risk going forward. So do you know your cholesterol? Yeah, mine's 5. My HDL cholesterol, let's just say it's 1 millimoles per liter. Cholesterol is a fundamental risk factor for cardiovascular problems. It's one of the main, when we talk about what causes or starts the process of damage to vessels that can cause cardiovascular disease, cholesterol is one of the fundamental molecules that are involved in the creation of plaques, which are the commonest things that tend to cause heart attacks and tend to cause stroke. You can't have a plaque without cholesterol, and the rationale is if you can lower cholesterol, especially kind of bad cholesterol, so to speak, then you can decrease the total number of these cardiovascular events across a population. So knowing cholesterol is important. I often find that people are quite obsessed with their total cholesterol number, even though it's not the most useful parameter. There are loads of different ways of looking at cholesterol. I guess generally, if the total cholesterol is high, that does need to be looked into. If the triglycerides are high, we need to look into that. If your low density lipoprotein is high, that needs to be looked into. There are additional tests that you can do, which are even more predictive of cardiovascular risk, such as apolipoprotein B. That's not a standard test that's done in the UK, but it is something that is very highly correlated with risk of cardiovascular disease. There's also blood tests that relate to genetics, known as Lp(a). So about 5 to 10% of people may have this marker in their blood, which can be strongly associated with heart problems and cardiovascular disease, especially when that happens in younger people. Do I know my blood pressure? Yes, I do. It's actually systolic blood pressure, not total blood pressure. Systolic blood pressure is the pressure at which the heart pumps fluid around the body. So there's 2 numbers when it comes to blood pressure. The first one is that pumping pressure, the pressure in the vessels as your heart pumps blood all around the body. And then the second number is the pressure at which the blood flows back into the heart. That's known as the diastolic. So in this tool, we're interested in the systolic blood pressure. Mine's 120. Normally anything around 120 over 80 is considered around normal. Lower than that is also better, generally, as long as you're not symptomatic or you're not lightheaded or dizzy. But blood pressure, again, intimately linked. It's a core risk factor for cardiovascular disease. Again, thinking about the vessels and damage to vessels, if you can imagine an increased pressure over time, often decades, damaging and causing small changes to the blood vessels, that just increases the risk of further degeneration. It also causes an increased risk, an increased process by which these diseases tend to occur faster. So blood pressure, a key component, and why we're interested in checking this regularly when you see your clinician, especially if you have cardiovascular disease already. So if you have it, controlling it is really important. Even if you don't have it, picking it up is important, which is why most high blood pressure is diagnosed serendipitously. Just when you go in, randomly check your blood pressure at home, or you see your doctor or you see the nurse, they'll check it and it's high. Often it doesn't come with symptoms. It's probably one of the most underdiagnosed conditions out there, and it's responsible for a huge amount of ill health and disease. It underpins so much of the disease that causes death and disability. So if you don't know your number, I would say it's probably up there with one of the top 3 numbers for your health that you should know is your total blood pressure. If you don't know what it means and you can't quite make sense of it, then take that number with you and speak to your clinician or healthcare professional to make sure that it is where it should be for you in your life and for your circumstance and context. Do you or have you ever taken medicine for your blood pressure? No, because I don't have it. There's a problem. Enter a real postcode. Okay, let me just do that again. Okay, let's try it again one more time. There we go. So my heart age is about 50, which isn't great. That's about 8 years over what it should be. I want to stress as well that these are tools. I mean, I think personally, myself, I know that my heart age isn't like this from other tools that I've done, but it's a guide. And I think the main thing with this tool is understanding a little bit about risk here. So I think what affects your heart age is what it tries to explain, why my risk or why my heart age is higher than my actual biological age. So the main things that have increased my heart age from a healthy 42-year-old to a 50-year-old: smoking. So it's saying that I quit. I used to smoke. Now I don't. Great. That's obviously good for your health, but having smoked has and weighs on to some degree. Weight, yeah, so it's saying that my BMI is high, so it's slightly above what the normal range should be, which is between about 18.5 to 25. So technically I'm overweight. BMI is an okay proxy marker for health. What we do know is that having an ideal weight for your frame is associated with better health outcomes across the board. Again, BMI doesn't always take into consideration muscular mass and for people that are quite athletic. So I do a reasonable amount of weight training, kind of key important parameter, as is smoking. My cholesterol levels is saying that it's normal. My HDL cholesterol, this is one of the good cholesterols, the cholesterol level that you want to be high. This type of cholesterol is quite useful and important in returning excess cholesterol that's circulating back to the liver where it can be reused. So that level to be high is a good thing. My level here is on the lower side of normal. Normally for men, we recommend it to be over about 1.2. Cholesterol levels, it says that you can improve through different means. And then blood pressure, it's saying that my blood pressure is high to normal. Again, a slightly lower level is good, but 120 for most people that I see is actually not too bad. But it's saying here that it is a little bit high, and it gives us some advice on ways to lower that. Again, contextualizing, I think when we're looking at these results, if I was going to do this and go through this marker and go through this whole calculator again, if I wanted to get my heart age to 42 based on the accurate things that I've said already, one is not being a smoker. Actually, before we talk about that, let's talk about the kind of modifiable and non-modifiable risk factors. So there are things that we can do something about, and there are things that we can't do things about. So things that we cannot do a huge amount about are things like the fact that I'm male. One of the original questions it asked was, what is my gender? I can't do a huge amount about that. That is not, there's no point worrying too much about that. I can't do a lot about my age. If I had everything exactly the same, and instead of me putting down that I'm 42 and I put that I'm 82, my risk, my heart age is likely to increase with that. We can't do a huge amount about things like gender. We can't do a lot about age. We can't even do a huge amount about genetics other than understanding your genetic risk, especially if there is a strong risk in your family. What we tend to be more interested in, and what you should be focusing on too also, are the modifiable risk factors, things that you can do stuff about. When it comes to modifiable risk factors and cardiovascular risk, things that increase the risk the most are modifiable. So even though we went through a whole host of reasons about why your heart age can be made worse related to things like kidney disease and rheumatoid arthritis, those aren't the worst things, or those aren't the most important things that affect your risk in totality. The most important things are blood pressure. The most important things are cholesterol. The most important things are smoking and weight too. So those are the things that we want to prioritize as much as humanly possible. So managing weight, understanding and knowing what your blood pressure is and doing the appropriate interventions to decrease that are kind of key and critical. That's where we should be working a little bit harder to try and improve our cardiovascular health. So for me, if I said that I wasn't a smoker or never smoked, and if my weight was, let's say maybe 3 or 4 kilograms less than it is at the moment, half a stone or so, and my cholesterol levels were a tiny bit better, and my blood pressure was a little bit lower, then easily my heart age would be at least 42, if not lower. All of these things, blood pressure, we can do things about related to exercise. If it's related to exercise and diet, if it's high, then obviously obviously you need medications. Cholesterol can be modified by diet and in some cases medication, and weight, of course, we can do a lot about in terms of the ways that we live our lives. So I think the main take home here with this tool is to understand what are the things that we can do things about, understand whether our risk generally is in the ballpark of what our biological age is. Does it kind of match up? Here in this instance, for me, my risk is a little bit higher than I would have anticipated. And I can see the areas that I need to focus on. My blood pressure, my cholesterol, and my weight are the kind of three areas where I really need to be focusing on, and I can get that heart age back down closer to where it should be. If you've got any concerns about your heart age and understanding your cardiovascular risk, then I would say this is key, and it's a really key and critical area. Speak to your healthcare provider about this, especially if there's a family history. There are ways to really know your risk to a percentage point, much more accurate than what we've covered at the moment. This is just a guide for discussion. Cardiovascular disease is one of the commonest diseases in the world. It's good to know your cardiovascular risk and speak to your healthcare professional to get more tailored advice. Thanks for watching. Till next time, stay healthy.